President Muhammadu Buhari commenced the military on quick response and rescue of students and staff of College of Forestry Mechanization, Afaka, Kaduna State. Just as 180 students rescued during the abduction are released to go home. Plus, more than 24,000 poor and vulnerable households in Yobe State benefit from federal government's conditional cash transfer program. These and more on Panorama. I'm Ayodeji Makindi. President Muhammadu Buhari has warned terrorists and bandits targeting schools, saying the country will not allow the destruction of the school system. President Buhari, however, commended efforts of the Kaduna state government and early response of the military, which led to the rescue of 180 students, including 8 staff members, but urged that the others declared missing be found and returned safely to their families. The president also commended efforts and contributions of local intelligence in significantly thwarting the kidnappers, saying that a country which has an efficient local intelligence network is a safer country. President Buhari expressed sympathy with the victims of this incident and hoped for an early end to the ordeal of those still held captive. 180 students of Federal College of Forestry Mechanization, Afaka, Kaduna State, rescued during the abduction have been released to go home. Abdullahi Muhammad reports that they were reunited with their loved ones following counseling and medication for the wounded.
In buses and trucks, they came with heavy security cover into their school for the first time after a traumatic experience they were taken. Moments after, they began to come out in droves with loved ones opening their arms for them. The means of transport home here doesn't count, but what takes them home? When the microphone reaches some of them, their stories heartbreaking.
The kidnapper now asked him to take them to the female hostel. On reaching there, he now said, "This is the female hostel." He now pointed to them, "This is the female hostel." Then he now hit the kidnapper and tried to run. Then now started shooting at him. So that was where he escaped also.
And the bandits were fully prepared for the operation. If not for the intervention of the security agency, I think it was not possible that they will have carried all the students.
They didn't go home without proper medical checks and counseling.
We also look at their food needs, their hygiene condition and things like that, and where we need to bring in medical personnel to be able to address some of their issues, we also do that.
And giving them hope is the air and ground patrol in search of their colleagues yet to be rescued from the den of the bandits. In Kaduna, Abdullahi Muhammad, NTA News.
Now, when a family is hit with the sad story of abduction of their member, holding tears is difficult. So was the circumstance Abdullahi Muhammad met at Ede's family, looking forward to the rescue of their son, Benson Ede, who is among the 39 students abducted at the Federal College of Forestry in Afaka, Kaduna.
The cockcrow grazed our arrival at the home of the Edes, but the atmosphere was moody. All is not well with the family as the last-born of the house, Benson Ede, is being held with 38 other students of the College of Forestry Mechanization, Afaka, Kaduna. The head of the family calls for unity in ending the menace of banditry.
We need to work as a team, whether north, south, east and west. Nigeria we don't have any other country except we want to describe something else. So please, it is very, very important that our government should be realistic and holistic in their approach.
I'm praying seriously that they should rescue these children this weekend. They should do something about it.
Emotional, the mother of the house was, but strong in prayers, and this is what those doing the needful need to succeed.
The federal government is collaborating with states to ensure that adequate security is provided to these schools so that we don't have this kind of instances.
In Kaduna, Abdullahi Muhammad, NTA News.
Chief of Defense Staff General Lucky Irabo says troops of the Nigerian military will continue with their onslaught to clear all enclaves of Boko Haram terrorists and restore civil authority. General Irabo stated this when he led the service chiefs on a routine operational visit to Maiduguri, the Borno state capital. Maimuna Garba reports.
Second operational visit by the Chief of Defense Staff alongside service chiefs to Borno less than 2 months after their first visit upon assumption of office. The operational visit led by the Chief of Defense Staff, General Loke Rabo, was part of efforts to ensure troops and commanders on the front line are continuing with their onslaught aimed at ensuring total annihilation of remnants of Boko Haram terrorists, especially those hibernating around the Timbus and Timbuktu triangle.
It's a routine visit meant to ginger our troops, meant to motivate them to also get to know what their challenges are and then to solve problems right in the field.
General Erabo commended troops' resilience and the successes recorded so far, urging them to continue with the doggedness as the president has been following happenings across the theater.
Well done! Thank you, sir! Well done! Thank you, sir!
The CDS and the service chiefs later held a high-level meeting where the theater commander and other unit commanders briefed them on the counter-insurgency operations.
We are encouraged, sir, by this visit to even redouble our effort towards achieving our mandate.
They also visited wounded soldiers receiving treatment at 7th Division Hospital, Maimalari Cantonment, assuring them of adequate medical care. In Maiduguri, Maimuna Garba, NTA News.
It's time now to join our Benin Network Center where Agatha would continue with the rest of Panorama.
Thank you, Ayodeji. A warm welcome to Benin. Our research plays a vital role in the development of the society, being the basis of knowledge, constant innovation, and new discoveries. Hence, the need to give priority to research development. Our Dennis Temple in this report samples opinions of some academic experts in Benin on how Nigeria as a nation can maximize research for national development.
In every society, there are development challenges, things that are not yet known regarding why they occur, their consequences, and how to prevent them always pose greater challenge. Hence, research becomes very crucial. People have the view that research has not been given its rightful position, considering that problems are multiplying by the day. Universities which are looked upon to lead in research and innovation contribute very small aspects essential for national development. To deal with these factors, a multidisciplinary research approach is suggested in order to break even.
Research is no longer one-sided. If you're going to get a solution to a problem, you need a perspective of many persons. And so when you bring together these disciplines, you do a multidisciplinary research. A case in point was during the COVID-19 outbreak. We knew we needed to do something about testing for COVID-19, especially the confirmatory test.
The people say there is need to invest in research and allocate significant proportion of national budget towards research development, as well as building new generation of researchers who will bridge the communication gap between researchers and end users.
So it lies both with the researchers who may not know how to communicate their research findings to relevant policymakers, but also the policymakers who are too busy to read basic scientific information.
Supporting research development, they say, is key towards taking a leap in technology and national economic development. In Benin, Dennis Temple, NTA News.
Center for Disease Control NC to COVID-19 update now. The Nigeria Center for Disease Control NCDC has confirmed 205 new cases of COVID-19 in the country as of the 13th of March 2021. A breakdown of the new cases shows that Ondo has 33, Lagos 25, the FCT 22, Bauchi 21, Akwa Ibom 15, Kaduna 14 and 13 each in Katsina and Ogun states. There are 8 new cases in Edo, 4 each in Ekiti and Imo, 3 in Kano and 2 each in Nasarawa and Niger. Total confirmed cases are now 160,537. 144,714 patients have been discharged and 2,013 deaths recorded. Now, the world is currently talking about vaccines for the dreaded coronavirus, which has claimed millions of lives worldwide 1 year and few months after its discovery in Wuhan, China. Now, Nigeria has joined the League of Nations which have received doses. Adogbeji Ojegba reports on the steps so far in Edo State and the disposition of the public towards it.
Edo State government received 81,080 doses of the AstraZeneca COVID-19 vaccines for distribution in the state Wednesday night, alongside other states with the highest incidence rates. The allocation to the state was received with the determination to administer the vaccine as soon as possible. All preparation, including training of health workers at all levels, have successfully carried out.
I must remind you all that we have actually done all the preparatory activities in the state. We have trained healthcare workers at the state level. Even at the local government level, we have also trained healthcare workers, and all that trainings are ongoing.
The latest development has not gone without the federal government being commended for its role in curtailing the coronavirus pandemic. The public is hopeful and expectant.
The information we have gathered is for our good, so I will be willing to take it.
The vaccination is good, and so we are going to listen to the medical experts. Appeal to everybody to also join. Prevention is better than cure.
Vaccination of Nigerians against coronavirus pandemic commenced with 4 health workers taking the first shot of the vaccine at the National Hospital, Abuja. In Benin, Adogbeji Ojegba, NTA News.
And to speak more on the COVID-19 vaccination starting Monday, that's tomorrow in Edo State, we have Dr. Andrew Obi, the Incident Manager COVID-19 in Edo State. Good morning, Doc, and welcome to Panorama.
Pleasure to be here today.
All right. For starters, how necessary is this vaccine?
Well, to speak to vaccination, it's a very strategic step towards control of any outbreak. Research has shown that it's a very cost-effective intervention. But looking at the entire picture, we find that it's an aspect of the entire response. So there are other aspects to it. So to speak directly, vaccination is important, especially when we have to deal with novel issues like the COVID-19, and we're trying to see how we can build herd immunity. Herd immunity helps protect majority of our people, and one of the fastest way of achieving herd immunity is to carry on vaccinating. It's very important.
Okay, since Nigerians heard of the vaccine coming in, there have been several misconceptions around the vaccine. Can you throw more light on that?
Well, we want to look at what would drive better acceptance. You always have misconceptions. Last year, when we had to deal with the COVID-19 issue, there were a lot of issues bordering on whether it was real or not. But I think that's over and done with now. You're getting more acceptance now. People now know that COVID-19 is not a hoax. It's something that we have to come to terms with. Looking at the vaccination, I want to speak more in terms of the vaccine being something that is needed, to help us contain the outbreak. The vaccine that we have received into the country that we also took delivery of on Wednesday, the 10th, at about 8:30 p.m. The AstraZeneca brand, Edo State received 81,080 doses. Preliminary information at our disposal shows that they are safe and effective, and our target now is to see how we can work in line with the national directive in terms of the phased distribution or administration of this vaccine, which it's commencing, like you have earlier mentioned, tomorrow, to ensure that as quickly as possible, based on the support we're going to get from the federal government, that we get at least 70 to 80% of our population vaccinated. So we want to drive acceptance. In the past few days, we have been carrying out a lot of risk communication engagement, a lot of jingles, and a lot of grassroots mobilization, because that's critical. Just like you said, there's a lot of misconception. So we're getting to the people, making them understand that this is necessary. Vaccination is necessary to help our people, acquire herd immunity. And once you get herd immunity in terms of at least 70 to 80% of our population vaccinated, then we can break the chain of transmission. Okay. But it's also important to note that vaccination is not just all about vaccination. There are other necessary steps that we must walk in tandem with, especially in relation to uptake of the non-pharmaceutical interventions like the hand washing, the wearing of face masks, observing physical distances. Yeah. These are very key aspects in terms of breaking the chain of transmission, which we must also emphasize.
Okay, now, who gets vaccine from tomorrow?
Yes.
And people in isolation centers, patients already in isolation centers, will they be given a shot?
Well, you know the phases. Now, what we're doing presently is that we're starting with the frontline healthcare workers, and this is phase 1. It's not for the general populace, but this is also very important because we're trying to drive acceptance. The people who provide care, the political leaders and the religious leaders who we have termed as strategic leaders, people seeing them take vaccination will build acceptance, and that is very, very critical. People want to see the governors, want to see other persons in government, the religious leaders, us, the frontline health workers, take this vaccination. And so those are the kind of people we're going to see now in the first phase. We're also going to see non-healthcare frontliners, the security agencies. They are also represented. They would be seen taking vaccination from tomorrow. And we are working around the corner to make sure that if we have extra vaccines, we could start up with some persons, maybe in our treatment facilities, who have comorbidities. But working with the national directive in terms of phase 1 is critical for the healthcare workers, strategic leaders, and non-healthcare frontliners like the security agencies to start them with the vaccination first.
Okay.
Then moving forward, we'll get to every other person.
And I understand that for tomorrow, it's just the first dose. What's the difference between the first and second dose of the vaccine?
For the AstraZeneca brand, you need 2 doses to build sufficient immunity. Okay, immunity has to do with your body's response to the vaccination. So we have been assured by the federal government through the National Primary Healthcare Development Agency that the state is going to take additional delivery of another 81,000 plus doses in the next 7 to 10 weeks. And this is very important. So what you're going to see tomorrow is that we are initiating a process, and we're going to be on for another 10 days, okay, to ensure that all frontline healthcare workers, strategic leaders, and security agencies personnel are vaccinated. Then in the next 7 to 12 weeks, when we get delivery of another batch of vaccines, we'll ensure that they get another dose, and that will ensure that they have their complete dosage. But as a state, we are also working around the clock to make sure that we strategize in such a manner that the doses that we are getting will work around it in a way to ensure that even before we get the next consignment from the federal government, whatever is left, we'll use that to initiate the second phase of the vaccination process.
Okay, now you take the first dose, you take the second dose. How long will the immunity last?
Now that is the big question, which it's a global issue. Nobody knows how long the immunity that we're going to get from vaccination, especially with regards to COVID-19, would last. And that's why in the course of this engagement, I said earlier on that we must also observe the other non-pharmacological intervention. That is very, very important. But looking at history, looking at other jabs, flu jabs that you have globally, it may be something that we may need to take annually. Okay, and the implication of that is that following vaccination, the immunity could wane. But we are still looking into research. A lot of research is still being carried out to know if and as at what time we are going to have possibly another shot of that, or if there's need for us to have what we call booster shots. These are things that research is actually looking into. So nobody can say with all certainty that when you take the 2 shots, if it's for the AstraZeneca brand, there are other brands that you could just take 1 shot, whether it's going to be something that you may not need to take again. So we're working around the clock to ensure that whatever information we get in terms of the duration of immunity is also provided to the public domain.
All right, thank you so much, Dr. Andrew B., Incident Manager, COVID-19, Edo State. Thank you for your time on Panorama.
It's a pleasure being here today.
All right. We'll take a break now. Panorama continues shortly. Do stay with us.
For now, the best and most efficient way to avoid getting infected is through regular hygienic and sanitary practices, as well as social distancing. As individuals, we remain the greatest weapon to fight this pandemic. By washing our hands regularly with clean water and soap, disinfecting frequently used surfaces and areas, coughing into a tissue or elbow, and strictly adhering to infection prevention control measures in health facilities, we can contain this virus.
Fathers.
I will urge and advise our younger generation to use talent and brain to sort out problems, not arms.
Nigerian youths, let's build our nation.
My advice to these young people is please do not take us back to those harrowing days. You probably do not know what it is.
I believe we have fought one civil war too many in this country. So those who experience it will run away from it.
Nigerian youths, let's build our nation together.
Thank you for staying on. Director General, World Trade Organization, Dr. Ngozi Okonjo-Iweala, is in Nigeria to meet with government and the business community on issues aimed at benefiting Nigeria in the African Continental Free Trade Agreement market. Benny Adams reports.
Resumption of duty as World Trade Organization Director General, Ngozi Okonjo-Iweala hit the ground running with trade negotiations bordering on cutting fisheries subsidies and reforms at the WTO.
We have a lot of work to do, so I feel ready to go.
Today, she arrives Nigeria with same commitment to fostering trade in an era of global economic recovery.
And to do that, of course, we have to improve investments. We have to add value to some of our products. We have this Continental Free Trade Agreement is a unique opportunity for us to be able to engage commercially with the other nations in Africa, and that will boost exports. And then when you boost exports, you create more jobs. We're also going to talk about the digital economy.
We have received a lot of support from many countries, so we appreciate them. And her visit is specifically to start from home. Charity begins at home. She says thank you to Mr. President, thank you to Nigerians that have.
To actualize her plans, the WTO Director General will be meeting with government, the business community, and other stakeholders for strategic planning. In Abuja, Benny Adams, NTA News.
Update: Samuel Johnson is our guide.